Hello friends, in this video we will talk about TS of Pons and the Pontine nuclei with applied aspects. So we will try to identify introduction, TS of Pons, applied aspect and the cranial nerve nuclei in the Pons or simply Pontine nuclei. So as we know, Pons is the middle part of the brainstem, and what is the importance of Pons physiologically? Respiratory control center is the Pons, or we call it the pneumotaxic center also. So let's see the two levels of Pons. One is in the lower part and the upper part. So what we are finding? In the lower part we are finding this MTR. So MTR is there. Then we are seeing the abducens nucleus, the abducens nerve, this one. Here we are seeing the facial nerve. Here the spinal nucleus tract of trigeminal. Then the cochlear and the vestibular component. Okay. Then we are seeing the inferior cerebellar peduncle and trapezoid body over here. Here the lemniscus, only spinal and medial, no lateral and trigeminal. Remember this point, lateral and trigeminal you will see in the midbrain. This is Pons. In the Pons, only spinal, here only spinal and medial lemniscus. And here we are seeing the bundles of corticonuclear and spinal fibers. I told you in the midbrain, right? CNS fibers, those are the ones. Okay. So this is the lower part. Now let's compare with the upper part. So what will be the important features in the upper part if we compare the two diagrams? The fourth ventricle, superior cerebellar and the middle cerebellar peduncle, and here trigeminal nerve. Here the nerve present is trigeminal. Remember this point, that trigeminal is mixed nerve. Both motor and the sensory branches will be there. Okay. And all the lemnisci will be there. As we saw in the midbrain, all the lemnisci will be there. So what will be the difference? Here extra lateral and trigeminal. See now, lateral and trigeminal. This extra will be there. Okay. Just compare and see. Here we are seeing spinal and medial. Extra lateral trigeminal got added. That's all. Okay. The rest everything is same. So what will be the differences? Remember this. Number one, fourth ventricle, all the lemnisci, okay, superior, middle cerebellar peduncle and trigeminal nerve. Please remember these four differences between the lower part and the upper part. Let's see with the applied aspect. The most important one is the Miller-Gubler syndrome. So where does this happen? I'll show you the site here. This is the site. So in the lower part of the Pons, Miller-Gubler syndrome happens. Okay, this is the site. So see my cursor which is moving on that site. This is where Miller-Gubler syndrome happens. Here this site you are seeing the pontocerebellar angle syndrome. But Miller-Gubler syndrome is important for us. Okay, so this will be the site of lesion. Let's see the clinical features. So ipsilateral, contralateral, two sides. Okay, ipsilateral you are seeing the squint and the facial palsy. Facial palsy is also called Bell's palsy. Bell's palsy is a lesion of facial nerve. That is why facial nerve is there. And medial squint you are finding sixth nerve. I told you the difference between third, fourth and sixth nerve. Squint will be a common feature. Extra specialty of fourth nerve will be downward gaze. But anyway, coming back here, medial squint involves the sixth nerve. Okay. And contralateral, as usual, hemiplegia, corticospinal tract. Okay. Let us see with the cranial nerve nuclei in the Pons. So what are the nuclei we are observing? 5 to 8. Just remember the order of numbers. It's very easy. What comes after 5? 6, 7, 8. Like that. So I'll show you the nuclei once again. See now, this is trigeminal. We are seeing in the Pons. Okay. And here you're seeing the facial nerve in blue. In red, you are seeing the abducens. And here you are seeing the vestibular and cochlear. Together, vestibulocochlear. And now before I discuss or tell you the cranial nerve nuclei, please remember this. You may be asked, what are the cranial nerves coming from the pontomedullary junction? Whenever you are asked this question, please tell your answer as fifth and seventh nerve. Okay. In the seventh nerve, I explained you the origin. It was coming from pontomedullary junction. So please remember, fifth and seventh nerve strictly comes from pontomedullary junction. Okay, right. So let's now see the cranial nerve nuclei. So just only components are important. Fifth nerve, SVE and GVE. This will supply muscles of mastication, temporomandibular joint and the first arch. Sixth nerve, GSE and A. Just in place of E, A. That's all. This will supply the extraocular muscles. Which muscle of the extraocular? Lateral rectus. Okay. And 7, facial nerve. This will supply all the glands, submandibular, sublingual. Please don't include parotid gland. Strictly please, no parotid gland. Parotid gland is supplied by glossopharyngeal. Please remember, there will be glossopharyngeal fibers, but yeah, okay, but you can still include parotid gland. That's not an issue. And eighth one is going to supply your what? It is going to supply your ossicles. Sorry, not ossicles. It is going to supply inner ear. Inner ear consists of cochlea. Cochlea, organ of Corti, semicircular canals, and the vestibule. All this will be supplied by eighth nerve. Okay. So 5 we are having the SVE and GVE. 6 we have GSE and A. 7 we have SVE, S and GVE. Then SVA and GSA. 8 SSA. If you know second nerve, eighth nerve is very easy. SSA, even second nerve also the same. Okay. So references from where I took the images. This brings us to end of the video. So thank you so much. I'll see you in the next video. And with this, we have finished the brainstem series. Thank you.